another topic. We're going to talk about asthma and sinus disease. And we had a question from a patient, actually I've had it multiple times in my career, but just one brought to light recently that reminded me that there is a relationship between sinus disease and lung disease. And the reason for that is the skin in the nose and the skin in the lungs are the same type of skin. They're both pseudostratified respiratory epithelium, and they have these little cilia thing that sweep the mucus through the nose. So what happens is when people have chronic sinus disease and a component of reactive airway disease, I kind of explain it to my patients that, whatever grows here is going to grow here. Okay, just like if you have a plant that you pull, out of rich dark soil and you try to put it at the beach, it's not going to live. It needs to be in that rich dark soil. And the same is true for whatever kind of bacteria or problems that you have growing on the skin and the nose. If you're breathing through this trash can and you're constantly soiling the skin with the stuff that's in the trash, so to speak, in your nose, you're going to create a mild, low-grade inflammatory process that's sort of always going to be there. And that doesn't mean that everybody that has asthma needs to have, CAT scan of the sinuses, or we need to aggressively chase down people with asthma. Not everybody has that combination, but for the people that do, and people know that they're having nasal obstruction, they're experiencing reactive airway disease, or difficult to control asthma. Let's say someone's on multiple medications and they're still not getting an adequate benefit. It's a reasonable thing to consider, looking for another cause. And we see this a lot in kids that have cystic fibrosis, people that have severe nasal polyp disease, and they're breathing, again, through that kind of trash can, and they're constantly just soiling their lungs. And so it becomes really important to make sure that we've removed as much of the sinus disease as we can. And in some cases, especially cystic fibrosis, it's very difficult to completely rid them of sinonasal disease. But we do know for sure that when their sinonasal disease is controlled, their respiratory disease is improved. And that's true for cystic fibrosis, but it's just also true for garden variety chronic sinus disease. So something to think about, something that the common public may or may not be aware of, but it's definitely a thing that we see frequently here. So the answer to that question, that was a long answer, but the answer to the short question, which was, does sinus disease contribute to asthma, is yes. Is it causative? No. Is it contributory? Yes. What percentage would you say? Varies from individual to individual, but if I had to put a number on it, it'd be somewhere 5 to 25% sort of range, if that's just gestalt. But anyway, that's kind of that's the relationship for asthma and sinonasal disease. Thanks.